Hello friends, welcome to Brain Scoop channel. This is my new video and our today's topic is RGU and MCU. Here RGU refers to retrograde urethropography and MCU refers to micturating cystourethropography. So firstly, let us talk about RGU. And retrograde uretrogram is a routine radiologic procedure, most typically in males, used to image the integrity of the urethra by using iodinated contrast media. Indications of RGU are strictures, urethral tears, fistula, urethral diverticulum and urethral obstructions. And there are some contraindications, which is acute urinary tract infection. Then contrast medium in RGU is HOCM, that is high osmolar contrast media, or low osmolar contrast media 200 ml, and in MCU it is 150 ml. Amount 200 to 500 ml dilute with normal saline. Equipments: fluoroscopy unit with spot film device and tilting table, video recorder, Jacks or Foley's catheter. In small infants, a fine feeding tube is adequate. Then syringes and xylocaine jelly 1 to 2%. Here are some examples of the Foley catheter and xylocaine jelly. Patient preparation. Patient micturates prior to the examination in both RGU and MCU and informed consent is taken. Technique. Patient lies supine on the X-ray table. Retract the foreskin and clear the tip of penis with betadine or antiseptic solution. Inject a small amount of local anesthesia into the urethra with a Foley catheter or syringe, and a balloon is inflated with 1 to 3 ml of water. Local anesthesia helps to relax the sphincter as the patient may contract it during the procedure and thus leading to a diagnosis of the stricture. Consent must be taken and contrast medium is injected under fluoroscopic control and films are taken. The male urethra is best seen in oblique position and female urethra is best seen in lateral or anterior posterior positions. Next, the imaging or the filming. The view of films: 30-degree left anterior oblique with right leg abducted and knee flexed. The next film is taken with supine PA, that is posterior anterior. Then 30-degree right anterior oblique with left leg abducted and knee flexed. Here are some imaging in RGU. The first one is the pre-contrast AP film, then right anterior oblique and the left anterior oblique. Here are some of the examples of RGU. Here you can see the junction of anterior and posterior urethra. This is the normal RGU and this is the abnormal RGU, where extravasation of urethral injury can be seen. Here are some more examples. Here a structure is seen. This is the normal urethra and tip of penis can be seen. And this is the bladder filled with contrast. It is the RGU in LPO position. And in this example, the backflow of prostate is seen. Then micturating cystourethropography, that is MCU. MCU is a fluoroscopic study of the lower urinary tract in which contrast is introduced into the bladder via a catheter. Voiding cystourethrogram demonstrates the lower urinary tract and helps to detect the existence of any vesicourethral reflux, bladder pathology, and congenital or acquired of bladder outflow tract. Indications of MCU are vesicourethric reflux, dysfunctional voiding, dysuria, and suspected urethral diverticulum. So, what is vesicourethric reflux? Is the backflow of urine into the ureter. This is the vesicourethric reflex as described in the diagram. Technique. The bladder is filled with contrast media using Foley's catheter. After the bladder is filled to its capacity, then the patient is asked to void. AP with full bladder for demonstration of these presence or absence of vesicourethric reflux. Both obliques to demonstrate bilateral vesicourethric junctions, and post-void film to check for a uretrocholy. Here are some examples of MCU. Here full bladder PA film is taken. Then there is bladder neck contracture which we can see in the MCU, and there is UTI. Films taken in MCU are lateral bladder, then lateral bladder staining when the staining catheter is removed, then lateral bladder during micturating. Here is full bladder in supine position in MCU, then left anterior oblique, right anterior oblique. This is preliminary film, that is the scout film. Then here is the oblique film and the post void. Aftercare in MCU. No special aftercare is necessary, but patients and parents of children should be warned that dysuria, possibly leading to retention of urine, may rarely be experienced. In such cases, a simple analgesic helpful, and children may be helped by allowing them to micturate in warm bath. There are some complications related to MCU and RGU, which are contrast reactions due to the absorption through bladder mucosa, then UTI, urethral trauma, intravasation of contrast due to the use of excessive pressure in stricture. And the complications due to contrast media are, that is, adverse reactions may result from absorption of contrast medium by the bladder mucosa. The risk is small when compared with excretion urography. Then contrast medium induced cystitis. There are some of the complications which are due to the technique, that is acute urinary tract infection, catheter trauma which may produce dysuria, frequency hematuria and urinary retention. Then complications of bladder filling, example perforation from overdistension, prevention by using a non-retaining catheter, example JACs. Then catheterization of vagina or an ectopic urethral orifice. Then retention of a Foley's catheter. This is all for today. If you like my video, please like, comment and share. And do subscribe my YouTube channel for further updates. Thank you.